Good evening, everybody. I'd like to call to order the March 27th, 2024 full board meeting. Please stand for the pledge. Next, we will have a reading of the mission statement from Wayne.
Our mission, Macomb County Community Mental Health, guided by values, strength, and informing choice of what people we serve, providing quality service with promotion, recoveries, community participation, self-sufficient, and independence.
Thank you, Wayne.
Welcome.
Next, we'll move on to item 3, adoption of the agenda. I'll take a motion to adopt.
So moved. Support.
Motion from Megan, support from Dana. Any comments or questions or changes to the agenda? Seeing and hearing none, all in favor say aye.
Aye.
Aye. All opposed? Agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Just give us your name. Anybody from the public wishing to speak? One more time, anybody from the public wishing to speak? All right, we will close the first hearing of the public. There is another opportunity before the end of the meeting. Next, we'll move on to item 5, which is minutes. Take a motion to approve the minutes of the regular meeting of the CMH Full Board held on Wednesday, February 28th, 2024.
Support.
Motion from Mark, support from Donna. Questions, comments, changes to the minutes? Hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Minutes are adopted. Next, we'll move on to item 6. I'll take a motion to approve minutes of the CMH Board Program and Budget Committee meeting held on Wednesday, March 13th, 2024.
So moved. Support.
Motion from Dana, support from Lori. Comments, questions, changes on these minutes? Seeing none, all in favor say aye.
Aye.
Aye. All opposed? Minutes are adopted. And now we'll move on to item 7. All of these items were discussed at program and budget, so I will take a motion to approve items 7A through J.
So moved. Support.
Motion from Megan, support from Mark. Any other questions or comments before we approve these? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Items are approved. Item number 8, receive and file. We have no items there. Item 9, resolutions, no items there either. Let's move on to item 10, voucher listings. I'll take a motion to pay the bills.
Support.
Motion from Mark, support from Lori. Comments, questions on the bills? Ken's already ready. All right, all in favor say aye.
Aye.
Aye. All opposed? Bills are paid. Move on to the CFO update with Ken.
Figure I'll get up during the voucher. If you had questions, and to answer them anyway. So, gonna start with. I'll start with the monthly financials in your packet. So on page 2, we're going to speak to this a little bit on the additional update, but we can see here that our revenue and eligibles are trending down as we've expected. The, I guess, unexpected piece of this, which there's been an analysis done. Richard gathered up a lot of data from the other CFOs to aggregate it statewide and present it to the state of Michigan on basically the trend that we expect our eligibles to fall down further than they had to pre-pandemic levels. So trying to shore stuff at pre-pandemic levels and the related revenue. So as part of that effort, we had a rate setting meeting last week on Thursday. So we don't have the detailed files yet from that meeting where we can do a really pinpointed projection, as pinpointed as a projection could be. But looking at in that 4% range as an increase to our base cap rates. So that's good news. We're getting more money. At this point, can't really project how much, but that's a rough estimate of where we're at. So the state is pumping about $116 million in statewide. So our piece of that is about, like I said, we'll have 4%. So that's good news. The other second major item to come out of that rate setting meeting was a DCW increase. This is another one that Richard was working with the state. They had indicated that they had funded overtime as part of the DCW rates. We couldn't figure out where that was actually included in revenue. And it was eventually, admitted to that it was not in fact in revenue. So now they're going to put those dollars in. It's not a huge increase on a per unit basis. Like it's about 16 cents per hour is what they're looking at putting in to the codes, but ultimately expect to go back and pass that on to our providers with a retroactive 10/1 date for that. So that is good news. We can go back and fund that as we know they've already been paying those overtime, and that's been expected. So we can help our network in that regard. Any question about the revenue or eligibles or what's going on with the adjustments as a part of that? Tracy, anything to add that?
No, I would just add a tiny bit that although we are projected going down further than originally projected, that's a lot of projecteds. Essentially, if you look at our total number of eligibles in Macomb County specific, pre-pandemic, post-pandemic, it actually is a little bit higher. So it's not less, it's not where it needs to be, but it's not as bad as, especially in comparison to other regions. There's other regions that are much less than pre-pandemic
Yeah,
in the projections.
I think it's very region specific as well, and Macomb is not in the worst shape overall. So that's good. Another thing Richard is advocating for when we talk to the actuaries is a region specific factor, because it didn't appear to be considered in that. So whether that'll be a pro or a con, if they do make a change for Macomb, is unknown. So we're kind of halfway through this thing, or maybe a little more than half, trying to shore up the system, and we should be seeing some more money, so that's good news. Page 3, nothing terribly.
Ken, hold on one second. Donna, go ahead.
Oh, sorry.
Yeah, I wanted to ask just a couple of questions about the information that you just gave us. On the 4% increase to base cap rates, I wanted to find out when that would be taking effect. Is that retroactive, or when would that start? And then the second piece, I'll just get them both out there. So
Okay.
I don't have to keep stopping, is you said it's $116 million increase statewide.
Yeah.
Do you have any estimate of how much would come back to Macomb County on that?
Well, if I looked at this, I would say probably $6 million is what we would be looking at as an increase in total. That's across Medicaid and HMP. But like I said, we get some detailed files. I think they're looking at early April for those.
Early,
So I expect to come back with, here's what we think a dollar is based on our actual rates in the schedules from the actuaries. So again, the eligibles, you try to trend out as best you can, but we might have a month in there where there's more or less. Hard to say what's going to happen. So we're expecting this to level off at the end of June, because that's kind of when they started the redetermination process. So hopefully going into next fiscal year, we have a much better picture to be able to budget and do everything we need to do. To your first question, it is retro back to 10/1. However, they're pushing all the dollars into future capitation payments. So it's going to be 6 months. They're going to spread that increase over the next 6 months through the end of the fiscal year. So it won't be like a lump sum, but they are going to retro it back. So we'll be made whole effectively on that.
okay, thank you.
Yep. On page 3, the only thing I wanted to highlight as part of this is our liabilities in cash remain high. We're finalizing our settlement for fiscal 20 right now. which is about $16.5 million that we'll be sending back to the state for that year. We already had that booked. Doesn't affect current year revenue, so nothing unexpected as it pertains to that. I'll skip over page 4. I don't think there's anything to note on that, unless there's questions on that page. Page 5 has kind of our funding buckets here. You can see on the net, Medicaid and Healthy Michigan together are running a surplus, but Healthy Michigan is falling off. The eligibles are falling off faster in that eligibility category than elsewhere. So that speaks to that negative 1.1 million, kind of in the second set of boxes there. Our CCBHC program continues to be strong, about $2.8 million local retained surplus we're projecting at this point. So that's good news. And then, as always, fully funded risk reserve and savings. Page 6, I guess I will call this this is the tough spot in our financial narrative. We talked about it at previous meetings. CCBHC non-Medicaid is woefully underfunded statewide. We can see it here in Macomb. It is a topic at the state. I know the association is pushing for it. There was a $5 million pot of money when there was, I think, 13 CCBHCs to start. We were one of those. They've since added 14 and not increased the pot. And on top of that, the 170, I think we received 171,000 in fiscal 23. I've yet to find anyone at the state who can say why we received such a low number out of the portion of the pie. So that is one of our major pushes. I think pretty much everybody's talking about it when they have an ear at the state level, but we can see it here. So our state general fund is actually running a small surplus right now, which is nice, but when you combo that with having to pay for the CCBHC non-Medicaid deficit, those two in total will be in a deficit position. We'll have to take it out of local, which, as I spoke to on the previous page, our CCBHC program is running a local surplus. So it is a net gain to us, but feel that the non-Medicaid folks, we should have some more funding for that.
Nick, go ahead.
Two things. So is it fair to say that the large increase in dollars to CCBHC was as a result of the expansion of the program in areas, not to fund any of them individually? Because the budget had an expansion of CCBHC money. And that went into creating new CCBHC areas.
I think it's a combination of both, if I understand it correctly, where, they're anticipating new CCBHCs. That is something.
Could you talk a little louder? The mic's don't.
Sure.
I should do the same thing.
I would say, I think it's a combination of both things, where it's additional money for the system as it stands currently. And then the state did say that I think they're looking to add potentially 10 new CCBHCs into fiscal 25. So some combination of those things where there's additional funding for those new ones as well.
So when I see the increase in funding, is that Medicaid and non-Medicaid or just Medicaid?
Just Medicaid,
So the non-Medicaid money is the area that we've got a problem?
yes.
Gotcha.
And if it's helpful, we did submit to the state. They asked, the state association asked that question, which that's good, because they heard us, and we did submitted the financials of where our gap is, so they can continue to advocate for that gap.
Yep, and Richard and I both sat in on a CCBHC work group that was led by Bob and Alan at the association, and clarified some of the funding, maybe misconceptions even I think when the state talks about it, sometimes it doesn't translate into the system here. And additionally to that, we reiterated the non-Medicaid issue, so they're certainly aware. And like Tracy said, we submitted some details on that. So our projection will be roughly 3 times this amount. So at the end of the year, we'll likely be in a $2 to $3 million deficit position with our general fund dollars. That's all I have for the monthly financials. I will dive into some of the open items we had. We talked about rate setting, the MAT, so open items with the state. Richard and others, Tracy, and continue to have conversations. We haven't seen anything in writing to my knowledge to this point, so that's kind of what we're waiting for. And if we receive that on state letterhead and so on and so forth, we can potentially move forward with that, depending on what it says. The ISF issue continues to be discussed. It was brought up in an FSR work group meeting, but I have not heard any updates on the template as it pertains to that, but we are moving forward under what we've been doing, which we feel is correct. My Health Link State inpatient, I've not heard anything about that. I don't know when I will hear anything about that, if we will. So we aren't paying it right now, so assuming the state will come calling for that eventually. And I already talked about settling 20. The last piece I wanted to talk about, you should have this supplemental schedule, whatever you want to call it, in your packet. I just wanted to put something together that speaks to the fiscal 23 ending results and compares it to the fiscal 22 ending results so that you can see it in a summarized format, or as summarized as I could make it for what I thought was relevant. You can see basically if we look at our total Medicaid lapse, which is the third line down, we've got about $17 million less going back to the state. A large reason of that is because as we shift services over to the CCBHC, it brings the supplemental revenue and the base cap portion of that with it. So that's a major driver of that decrease there. You can see our CCBHC amount owed to the state decreased, but also our receivable as it pertains to Medicaid on that. Our GF lapse last year, or for the current year, was about $2 million. That's $1.7 million in last year, so we did our best to try to spend GF down. Obviously, as I spoke to, that will not be the case. This line will look different going into 24. So I'd have our total net lapse to the state there, about $23 million. Any question about the top part? Okay. Heading down into the next section, you can see the current year column is our fiscal 23 numbers. We were able to retain locally roughly $12 million in the CCBHC program, which is amazing. $5 million roughly higher than last year. Fiscal 24, we will likely continue to have a surplus. Our PPS1 rate, though, for fiscal 25 is coming back down to everything we do is on basically a 2-year lag. So starting in fiscal 25, we'll be using our 2023 cost report PPS1 rate, and it's considerably lower. And it should bring our surplus to where we're operating around net even. So I don't expect this surplus trend to continue, but we've been fortunate to be able to benefit from it during this time. Our ISF ending balance is up $6 million. Again, that current year number is based on an actuary analysis that's independent of ourselves. So that's good news that we can keep that here for a rainy day. Medicaid savings is also up about $2 million, and our PA2 fund balance is up about $2.8 million. So those are all good things. That bottom portion being kind of our reserves, if you will. So I wanted to highlight that separately for the group. Any questions on that schedule or our fiscal 23 results?
Doesn't look like it. I don't see any. I don't hear any. Thank you, Ken.
All right, that's all I have. Thank you.
Thanks for the update, Ken. Next, we'll go to Tracy for her update.
In the past, we've talked about each time trying to educate you guys on one of the lines of service. I apologize, I did not get to add this to the board report that went out earlier today, but in front of you, and I can share it at a later date, you have two documents. One is our trifold, it's like to the public, and today I'm going to be talking with you about our children's mobile crisis. The second document that I'll highlight is kind of how many people we serve and the times of day they called. So I'm going to try to explain it in my plain language. We have a children's mobile crisis services. Eventually, over time, it will be 24/7. Right now, it's 6 days a week, and it's till 8 p.m. every day, except for Saturday, it's till 6 p.m., so morning till evening. But I believe it's 8:30, yeah. But then over time, we're trying to progress. But as of right now, we actually don't have a ton of demand during those off hours. But either way, we're moving towards long-term 24/7, a 24/7 solution. So mobile crisis, both for adults and children, what it is designed for is anyone. It does not have to be the people we currently serve. It could be anyone in the public can call. Currently, our process is they call the crisis line. The crisis line actually then reaches out to the applicable children's mobile crisis team member who's in the go. We always, they then reach out to the person who's, whether it's the guardian, the parent, whatever the circumstances are. We do not send anybody out into an unsafe situation, right? If law enforcement needs to call, law enforcement needs to be called. But over the phone is where they start, and they talk and find out more information about the particular situation. If needed, they will absolutely deploy, as in go wherever that family is at. So whether that be the hospital, whether that be their home, a park, whatever is occurring. And in those services, the purpose of them is to de-escalate, right? Because that is actually often what they do. When I show you the stats, I think you'll be very pleased. They're a great group of team members that are very dedicated and do a fantastic job for our community. So in addition to de-escalating, their goal is to get them connected. So great, we're now in this stable situation. Do you need the hospital? What do you need so you have next steps? And they, of course, follow up with them. So even if it's not our person, to try to get them connected over the next couple of days with whatever is needed. So this, again, is our public-facing document that we share with hospitals or anybody. So if you ever find a family that's in crisis, this is an absolutely great resource for someone to use. And we get wonderful feedback from, like, our partners, the JJC, as an example. They can't speak highly enough of it. So what I'm going to share with you, if you look at the numbers, I'm going to try to simplify it. Total serve, we're looking at last year. So when I say the word last year, that means October of 2022 through September of 2023. They've served 402 children and their families. Their deployment was 273. So remember I said they call, they talk with them, and there are situations that they're able to de-escalate over the phone or rectify, and then therefore they don't go out. Then if you notice total percentage of calls that resulted in employment, it's the same number, it's just a percentage, so 68%. And then timely manner, they have a goal, and this is true for both adults, I think is a little bit longer as far as number of hours, but children, it's 3 hours. So they basically met at 94% of the time. They were physically at the spot they were called to within the 3-hour block of time or less. Yes, and then if you notice from the calls deployed, the number of calls resulted in hospitalization was only 4. So I would say, point that out to you, because that translates into 1% of people. So again, this is a program that we know that we absolutely need for our community, but it's a great example of a way to put in other scenarios. And the hospital does make sense for some individuals in some circumstances, but it doesn't have to be the only solution. So I would just wanted to make sure you understood what we serve. If you notice the bottom chart is the call times. So just to give you the biggest times of the day we get phone calls are 9 a.m., between 9 and 12, and then 12 and 3, or they start running off after about 6 p.m. So you'll see the percentage of those. That's also why we're currently not doing it 24/7, because there really hasn't been enough demand yet to have 2 staff. I should have explained that. We always have a master level clinician and a parent support partner go out to the scene. So parent support partner is an individual who has lived experience, either they were a guardian or a family member of somebody who received services. And then, of course, the therapist is a master level clinician, and they both go out together, and there's a very specific model that they apply in order to de-escalate. Do you have any questions? Yes.
For the PSP, is that person a volunteer who does that,
No,
or they're
they're employed.
paid on? Okay, awesome. Thank you so much.
Tracy, the 3-hour timely manner, is that self-imposed? Does that come from who sets that?
Michigan.
State of Michigan? Okay. I figured as much, but wanted to ask.
If it's helpful, under the CCBHC, we're required to have 24/7 crisis services. So this is one of the things. And to be fair, even if we weren't a CCBHC, this is something we should be doing.
Right. Okay. Anybody else have any questions on this topic for Tracy? Okay,
Okay.
carry on.
Great. I'll try to be fast, but I do have a decent list. So earlier today, you did see the board report. Just to draw your attention, I'm not going to review everything there because there's a ton of good information there. But if you didn't see it, we are in the Detroit News. Specifically, Dr. Agnes Ward is featured due to doing an editorial about self-harm. So if you haven't read it, I did send it. Definitely check it out. And you'll see in our strategic plan and a couple other documents, we are trying to be a thought leadership. What that means is essentially seen in the public eye as an expert, right? And that we're a resource to further develop policy, further develop kind of programs, that type of thing. So you'll see, I think you've seen over the last couple of months, but you'll continue to see our efforts to continue to be that. You'll also see in the report that next month, we have a scheduled interview, we're scheduling an interview with Janet Marr and myself for MEA TV to specifically talk about autism. April is Autism Awareness Month. We also have a meeting or a interview scheduled with Janet Mara and CBS News. When I say scheduled, it's being scheduled. Also to talk about autism, again, for the same reason. April is Autism Awareness Month. So that's the upcoming kind of efforts or media. Other things I want to talk to you about. Last time in the board meeting, there were some safety concerns brought up about the north location and program. So in your report, forgive me, I'm trying to find it, I provided kind of a list of items that have been completed over the last couple of weeks. If you have any questions, I'm happy to answer them. I'm just going to do high level kind of summary. So in it, over the last 2 weeks, mirrors have been installed, basically to create, there are no blind spots in the hallways. When I say mirrors, kind of the top corner, you guys are familiar with the round mirrors. So that way, when you look up, you're not going to be surprised walking around a corner, essentially. Other things, there are some fishbowl peepholes that were installed. I think there's one that's glitchy, but there is some peepholes, and the concept of those would be before I walk into the lobby, which is the locked area, right? I can look to see what's out there. Other things is the application that we talked about in the past. Where it notifies if somebody's needing some assistance. It is in trial and it's working at the north location. I will explain to the best of my ability, but if you have questions, I'd have to send you IT. But essentially, there is a notification on the phones in what we call our intake room. So a room that somebody would meet with somebody in. They can push one of the buttons if they are in need, and it will send out a notification that location decides who's going to get it, right? And that notification is going to go to the desktop phones, who we've designated who should receive it. It goes to, as long as they're logged in, their desktop computer that we've issued. It goes to their cell phone if they've registered it, right? And it sends an email. We have them testing it, the site daily. I checked with IT this morning, and they are testing it daily. So to ensure that that is actually being, usable. Some of the other things is myself and or TJ at Facilities met with 3 different security assessment companies just to kind of start collecting some information. One of the ones we met is a no, and because they want to be able to use cameras as part of their solution, and I think you guys know we can't record in our facilities, so that's knocked it down to the 2. I did get some great referrals. I think the other 2 seem possibly viable, so we're currently trying to get proposals from them. Based on that research, we'll come back to you and figure out what makes the most sense. But remember, it wouldn't just be for that location, it would be for like the whole service delivery. Other things that have been done, and again, I'm not going to review this all. Access control on doors, we're still looking at which ones might make sense, essentially. I want to do one because I thought this was cool. So we have this app, that's amazing, right? But apps break, the internet goes down, right? You have these various situations. So one of the things we're putting out is IT did a great job creating a how-to guide. If you don't know this, if you have an iPhone, if you hold down one side, which is the power button, the other side, which is the volume, and keep it held down and just don't let up, it will call 911 and it will do it. And the concept is if I don't want to draw attention to something, I can be holding it down here, be holding it, right? Holding it down until it calls. Now it is going to call them, just to be clear, but during that time frame, by the time they pick up and anything is heard, right, they're already called. So again, we're gonna send out that kind of how-to as a backup, so if our application system's not working, and to be fair, also we have people in the community, we're just trying to share like things that already exist in order for people to have options and ultimately feel safe, essentially.
Android, sorry. I'm
Yes.
an Android girl still. If you hit it, I think 4 times the power button, like if I did it to test right now.
Let's not do
I
that.
think you do it 4 times and it does the same thing. And actually, I think it does a couple things where it, I too have accidentally done it. And I think it records the next 30 seconds, and anybody that you have like logged as a, in case of emergency contact, it will send a text to of your location or something like that, but it does do it. Android does have a thing too, though.
I did not know that. Good to know.
yeah,
So
4
we are doing the iPhone because we issue, the majority of our staff have an issued iPhone.
Okay.
Yeah. But the iPhone does, what's great about doing that is it's automatically sending, it's still calling 911 because that, remember, that's what 911 wants. They don't want a random notification, right? But it does also send the coordinates to the dispatch center. Yeah, so the person's getting the GPS also, so there is some advantage of doing it that way versus dialing 911. Other things, most of the other items are related to process and procedure that the supervisors are kind of working through and making sure the staff feel supported and heard and included into all of those things. So again, for the additional details, you can look in there. Just to save us time, I'm not going to review the rest of them. So I apologize again, I have a long list. So conflict-free, it's a good development week. Conflict-free, just as a friendly reminder, is the state of Michigan's interpretation of a CMS rule. So CMS rule tries to say, you must have a firewall between the person who writes a plan and the person who provides the plan or the services. The state of Michigan's most recent interpretation has evolved over time. I think we've been talking about this for what, at least 3 years, Nick, something like that? The latest interpretation is we still don't agree with, but Macomb is in a good place. So I'll explain. They have interpreted that you still have to follow this rule. You still can't have a person who plans, case manager, also provides services. When I say person, it's the provider. So in our example, they're saying you couldn't have a case manager who works for Macomb County Community Mental Health and then a therapist provide the services. So that's really bad, right? But what they've evolved it to is something that is not as bad. They said same is true, except for we're only going to apply it to the HAB waiver, or all the waivers, children's waiver, HAB waiver. So we in our system have less than 40 people that are on one of those waivers and have a case manager who is somehow associated with us, as in working for Macomb County Community Mental Health, and receiving other services from us. Our design has separate systems for that group, so it's not impactful for us. Now, just to be clear, we still don't agree with this. The state association is still fighting, and they still have, and you'll see this in there, some educational materials they're sharing with legislators, because there are other regions that's not what I just explained, and the little impact, it's not like that at all. They do have, to be fair, you'll see it in the PowerPoint that I attached, they do have outs. What I mean by outs or exceptions, if you're in a rural region and you're the only provider, right, but you have to apply for it, they have to get approval from the federal government, so it's not an easy type of scenario. Do you have any questions on, so that's, just to be clear, that's a very good development, even though it's still not quite what we want it to be. Any questions on that subject?
I don't see any.
Would be for sure. Okay. Next one is.
I'm going to jump in real quick. That's one that we did the resolution for a while back, opposing it to.
That was at least 2 years ago, give or take, right? Like, it's been a long.
Time is not a concept for me anymore.
It has, the great news is all the efforts, although we still don't agree with it, it really did make a difference, right? So they've narrowed it down instead of this broad stroke, because that would have been a hugely detrimental thing to the people we serve. Ken already talked about the Medicaid enrollment, so thank you, Ken. And then I continue, we are working, and you'll see a little update in the report about our providers. We do have 2 providers who are leaving us. Essentially, we are diligently working on getting additional providers, but at the same time supporting the providers we have. So I just want to draw your attention to the thing that we very much recognize that that's a gap, that we need to provide more resources and more time and more educational materials and whatever we need to do to support the provider network we have. They do a really good job, but they are in frustrated, just like many of the organizations in the US with all the changing dynamics. Last but not least, Mental Health Awards. Just as an update, we have 150 nominations. Very excited. Still looking for any type of donations as far as private prizes. We do have several. I'm very excited about the ones we already have. But if you know anything or have any suggestions for that, we, of course, welcome them. And then now, since she knows, the last thing I'll tell you is, in case Linda didn't tell you guys, we nominated the Metro Region, so Macomb and in turn, the Metro Region nominated Amir Jacobson to win the Jim Newbacher Award, and she was selected. So she will, and she confirmed, she will be in Traverse City at the state conference in June to accept her award, and she is beyond excited. Yes. So we're excited for her. And that is it.
Thank you, Tracy. Anybody have any questions for Tracy? Comments? Anything? No? Okay. Thank you. Next, we'll move on to other possible agenda items. I have a few reminders. The April Program and Budget Committee meeting will be Wednesday, April 10th, right here at 6. Full board will be here Wednesday, April 24th at 6. And we have a Recipient Rights Advisory Committee meeting Thursday, April 18th at the CMH Admin Building at 8 a.m. I have a couple things real quick. First off, I know we have a group here that was here a couple weeks ago, and I want to apologize for our technical difficulty that we had. This boardroom has seen its fair share of technical challenges the last few months, not just for our meetings, but for the Board of Commissioner meetings as well. And we're working through these technical glitches. The Board of Commissioners staff that deals with the IT here is losing his mind, so he's working through it, and I just wanted to apologize to the group that's here and to everybody else that was looking for the feed from 2 weeks ago. We actually found a new problem that nobody knew existed. So I guess because there was a Board of Commissioners meeting in here earlier that day and it was recorded, having a meeting later in the day somehow screws up. I don't know, whatever. It doesn't make sense. It shouldn't make sense. It should work. So hopefully we're okay today. Just wanted to throw that out there for everybody. And also I want to congratulate Lori, Donna, and Mark, who all happen to be sitting next to each other, I just realized that, for being reappointed to the board for another 3 years. So congratulations. Thank you. Does any other board member have anything else to add? Okay, we'll move on to hearing of the public. Anybody from the public wishing to speak, coming up, give us your name. You have 5 minutes.
Hi, everybody. I'm Nancy, the Director of Liberties, and I'm here to give you a report on it. Lots of good news. First of all, our balance in our checking account on February 1st was $61,692.80. March 1st, it was $59,513.81. It's progressively getting better and better, so we're ecstatic about that. We're hoping that maybe in 2025 we might be able to pay our loan back. So we're going, we're inching away at it. December 1st, we moved from Roseville to Clinton Township. The office is gorgeous. I love it. The members love it. They're feeling much more safer. It's really nice. I want you all to come and see it eventually. We are having a grand opening on August 16th from 10 to 6. It'll be on a Friday, so I hope some of you can come and see it. We are going to move over our north location, the one in Mount Clemens, May 1st. So that's right around the corner. So we've been very, very busy with unpacking from the other location and now working on this one. So we've been very busy. We haven't done as many events as we like to, but we will be going back to that real soon. Speaking of that, we'll be doing the 3rd annual Picnic for Liberties on June 12th at Swirly Top again. Let me see. I don't really have all that much. I just wanted to give you that update, I guess. And that's it. Any questions? I
We're
know it
set.
was short, sorry.
No, you're good. Thank you very much.
You're welcome.
Yeah. Kim,
Thank you all.
when you have a flyer or anything like that for the grand opening or the picnic, can you send it to us?
I
And
will,
get it around all the
definitely.
board members?
Yeah,
And
I,
I'm sorry for interrupting.
go ahead.
But if you also send out, remember, we can send it to the workforce update, the provider network, all those resources.
That would be great. I will do that.
Thank you.
Yeah, we have, we're planning on letting the state rep know for that region. And of course, Executive Mark Hackle. We're gonna reach out to about 200 people, so I'm hoping it's a good turnout and people are starting to realize that Liberties is there, because a lot of people don't know about it. So, that's it. That's my report. Any other questions?
All set?
Thanks, you guys.
Thank you very much. Clubhouse, you're next.
I had to check in with the boss first. We too just wanted to say congratulations to all the re-elects for the CMH board. It's a pleasure to have you serve us. Just a couple of things that we wanted you to put on the radar. For April 4th and April 16th, we have discussions with Crossroads Clubhouse. We're really looking forward to that. The one on the 4th is 9 o'clock in the morning. The one on the 16th is at 2 o'clock in the afternoon. We promise you that you will laugh. We promise you that you will probably cry a little bit. We're really looking forward to it. We have some great videos, some great things to share with everyone that participates in the discussions with. Coming up later on in the year, we have our reaccreditation that our Clubhouse International accreditation, it's actually expiring in the 1st of July. We applied for our reaccreditation in February, I think the second week of February. We got notified about 2 weeks ago that we're on the schedule for December. That's a good thing and that's a bad thing. The good thing about it is that it gives us just a little bit more time to kind of perfect a lot of the things that we're working on to improve the overall functionality of the clubhouse. I feel really, really good about that. The bad is that it's in a new fiscal year. Why is that important? Well, at the beginning of, or at the end of last year, we actually applied for federal block grant dollars through the Michigan Department of Health and Human Services to help us cover the cost for the reaccreditation. So that won't apply for 2025. We'll have to reapply and see if we can get block grant dollars again. But with that being said, we're hoping that those dollars get passed forward to another clubhouse that needs that money. We also were approved for out-of-state colleague training. So this is at a colleague training base. We have a soft reservations for Utah to send a staff person, one clubhouse member, and it's my preference that an administrator goes so that they can learn a little bit more about the clubhouse. The last time that we went, we sent an advisory board member. They had a great time, learned a lot. I've been 3 times, so I don't think that I get as much value out of going anymore as somebody that's not been involved in that. So we're hoping that someone will consider going in place of an administrator. And then in September is the Clubhouse International World Seminar. That's important to know because I think that Michigan is always on the radar for those world seminars. Particularly this year, the coalition actually did a reface for the overall organization. Crossroads Clubhouse was a heavy partner in that we established some purpose, mission, and vision statements for the coalition. We established a redesign of the organizational structure as a whole. We helped redesign the roles and responsibilities of all the different committees. We're right now rewriting the bylaws, which is so much fun to do, as you may know. But secondarily to that, we're also working on our social media, our larger impact on the community as a whole. So that would be really our internal and external communications. I would not be surprised at all if Clubhouse International asked Michigan to come and present at the World Seminar, but I just wanted to alert you of that now because that too is in the new fiscal year. So there's a little bit of cost for some of the activities that Crossroads Clubhouse has coming up in the next several months. Do you want to share something?
Oh, well, I guess I also want to make sure that everybody knows that I really appreciate Phil and Lori and Donna and Mark, and I'm glad you guys are back on for another year, 3 years. But also, since we are going to Clubhouse International, it's going to be out of country. We kind of want to give you guys a heads up so that you know ahead of time before we come up and we're not hitting you in the face and you're like, what?
British Columbia, Canada.
Yes.
Is where it is this year. Richmond.
Richmond.
I also want to say congratulations to Angel. She kind of stepped outside of her comfort zone and applied
Big
to
time.
be on the board of directors. Even though she wasn't selected, it does sound like she's going to be on the CAC. So I just want to say congratulations to her, and I think that she's going to do a great job for us.
Thank you.
So, thank you. I think that was longer than 5 minutes.
You were right on the dot. You were right on the dot, but there's 2 of you up there, so I was gonna give you 10 if you needed it. But just to jump in real quick, I hate to interrupt public comment, but Angel, you did a fantastic job. Thank you for applying. We were talking about that afterwards. You interviewed so well. I know you said you were nervous, but you did a fantastic
I
job.
was terrified.
You, you did great.
Thank you.
Anybody else for public comment? Anybody else? Last call. All right, we'll close hearing of the public, and I will take a motion to adjourn.
Support.
Motion from Megan, support from Dana. All in favor? Aye. All right. Everybody have a great Easter.